Your health. It's the most important thing in the world and the one thing most of us take for granted. You never know when it's going to fail you, but one thing is for sure, the best way to protect your health is to be well informed. Welcome to Your Health Matters. I'm Peggy Pico. Being prepared and informed certainly is the best way to maintain your health. But the reality is you never know when disaster is going to strike. Today on the show, we will be taking you behind the scenes of Eden Medical Trauma Center. Eden Medical Center sees an average of 2,000 patients come through their trauma center each year. Trauma is defined as any serious injury or strike to the body. Most of these types of injuries are the result of either violence or an automobile accident. For trauma coordinator Dr. Nora Sabiazimi, it's just another day in the office.
Okay, what do we have?
Okay, so we have
The type of trauma patients we see here at Eden is, I'd say, probably a good mix of both penetrating trauma and blunt trauma. Penetrating, essentially gunshot wounds, stab wounds, and as far as blunt trauma, we see a lot of motor vehicle accidents, bike accidents.
In 1987, Eden Medical Center was designated by the Alameda County Board of Supervisors to become the first trauma center to serve southern Alameda County. This act distinguishes them much more than just your typical ER.
Trauma room is different from an emergency room in the sense that the acuity of care is different. The severity of injuries is different. The time to treat these injuries are different. A lot of the injuries or ailments that come into the emergency room have a certain chronicity to them. And it's not as important to institute treatment as quickly as it is for a trauma patient, because we want to prevent the secondary complications of shock, hypothermia, respiratory distress, or death that can occur from traumatic injuries.
It's the EMT's job to assess the severity of the injuries and where the patient will be treated. Most hospitals' ERs are up to the task, but a fully equipped trauma center can make the difference in a life-threatening or limb-threatening emergency.
Essentially, the team is assembled before the patient even arrives. So the team consists of the trauma surgeon who's on call, responding, the trauma nurse. There's a scribe, there's a phlebotomist, a radiology technician, so the room can be set up in a quick fashion so that we can move right into the operating room without any delay.
The time that is saved allows these doctors to faster determine a patient's need, and that's the key in life or death situations. They even have a name for it.
Trauma is based upon the golden hour. If we can get to the patient within the first hour, we can drastically decrease the mortality and morbidity. In other words, death and complications. That first hour is critical.
In the best situation, trauma doctors not only save their patient's life, but also return them back to the life they had before.
You can see a fragment of bone here, and the break goes right through here. So, after the operation, the bone is perfectly straight, and she won't have any residual from it. She won't have a limp or anything. She'll be able to go back to her normal life.
For Kendra Verga, this was her normal life. An award-winning ice skater competing since the age of 5, but in one blink of the eye, everything changed.
I had looked both ways before crossing, and then halfway through I looked again, and I saw the car coming. I could see the bones were out of place, like you could tell they were broken. So that was one of the first things I saw. I didn't really know about my other injuries yet. That was the only one I knew about.
In fact, Kendra had several serious injuries, from broken bones, a fractured hip, and damage to her organs, but she credits the Eden Medical Trauma Team for keeping her calm and giving her back her life as it was before.
We're almost there. Hang in there a few more.
I kind of trusted that they'd take care of me, and just things were going so fast. You know, they were getting x-rays, CTs, checking to make sure that everything, seeing what the damage was. And I think they just did a really amazing job. I wanted to thank them for the amazing job they did, and working so hard, all the time to get me back to normal, basically, so I can skate again.
For Kendra, the prognosis is good. Doctors hope she will be fully back to normal in 6 months and someday back on the ice. Now with us from Eden Medical Center is Dr. Scott Snyder, Medical Director of Eden's Trauma Center. Now the Trauma Center sees a bunch of emergencies every single year, but the most important thing we were talking about was this golden hour. I heard Dr. Boyd mention that. Can you tell us a little bit about what that is?
That's right, Peggy. You know, the golden hour refers to a number of injuries that we know aren't fatal initially, but may be fatal within that first hour. So we've got that 1 hour of time to save a great deal of lives whose injuries otherwise may cost them.
And trauma centers, we're talking about trauma as opposed to emergency rooms. What's the difference between a trauma center and an emergency room?
Well, a trauma center is a higher level of care, and the room itself is built to do a number of different things. We can not only do diagnostic procedures, find out what's wrong with you, but we can even do procedures in the trauma room to save your life on the spot. We can operate in that room. We can do a number of procedures you can't do anywhere else in the hospital except for in the operating room.
So again, the timing is really, really important, it sounds like. If someone has a trauma, if somebody's having a trauma, what should they do? If you think it might be a trauma, should you call 911? Should you just try to pick them up and take them to the trauma center? What should you do?
If you think you've got a trauma, you should always call 911. 911 is the safest thing to do. It's the most efficient thing to do. And somebody who has a trauma, they may or may not be stable at the time when you're looking at them. Something may change. Their clinical course may change on the way to the hospital. If you've got paramedics taking you there by ambulance, 911, they've got equipment in the back of the ambulance. They can do things to help save you if those changes occur while you're on your way to the hospital.
Now, Kendra had this bone injury, and a lot of times people think, oh, big deal, it's just a broken leg or it's just a broken ankle. Are bone injuries serious, and what makes them a trauma?
Well, long bones injuries such as Kendra's are very serious. You've got a lot of blood inside your bones. Long bones tend to be associated with a lot of bleeding. And Dr. Boyd pointed out there was some deformity of those bones. That deformity can either encroach on blood vessels, which may cause even more bleeding. And a lot of times you may see a great deal of blood loss that can be life-threatening. So
again, possible broken bone, at least get some medical attention right away, whether it's ER or emergency room.
Possible broken bone, possible life-threatening injury. Need to go to the emergency room at the very least, and perhaps a trauma center would be the best place for you.
If you need to go. So we'll have a lot more advice coming from, your advice coming from you. Stay with us when we come back. Eden Trauma Center doctors tell you what you need to know about protecting yourself from serious head injuries.